Welcome back, everybody, to another deep dive. This time we're going to explore something that I think is really cool, and that's atraumatic exodontia.
Yeah, it really changes the game when it comes to extractions, for sure.
Yeah, it's fascinating how much emphasis there is now on making extractions less traumatic, not just for the patient, but also for us as dentists.
Right. It really takes the stress out of it for everyone involved.
Exactly. And one of the things that really stood out to me is the connection to implant dentistry. I
Hmm.
mean, preserving bone is so important for successful implants down the road, and atraumatic exodontia seems to be the key.
Absolutely. You're laying the groundwork for predictable and aesthetically pleasing results, which ultimately benefits both the patient and the dentist.
Okay, so let's dive into some of the specifics here. Our deep dive revealed some really important factors to consider before we even pick up an instrument. Smoking and diabetes seem to be at the top of the list.
Yeah, those two can really throw a wrench in the works when it comes to healing.
I remember reading this story about a professor at Columbia who was adamant about not placing implants in smokers.
Hmm.
He's like, nope, not gonna do it.
Wow, yeah, that's definitely a strong stance,
Yeah,
but it highlights how seriously we need to take these factors.
absolutely. So how do we effectively assess diabetes control before extraction? Is it enough to just ask the patient how their blood sugar is
Well,
doing?
it's definitely part of the conversation, but we need more than just a verbal confirmation. We need objective data, and that's where HbA1c comes in.
Right, HbA1c gives us that long-term picture of their blood sugar control, which is much more reliable than a single glucose reading.
You know, it's funny you mentioned that because I've actually had patients confuse their glucose level with their HbA1c value.
I've had that happen too. It's like
Yeah.
they see a number and assume it's all the same.
Exactly, and it just highlights the importance of explaining what this test means and why it's important for their overall treatment plan.
Couldn't agree more. Now let's talk about something I found super intriguing. Why is facial bone loss often more pronounced after extractions compared to other areas? What's going on there?
It's all about the blood supply. You see, the alveolar bone gets its blood from three main sources: the periosteum and gingival tissues, the blood vessels within the periodontal ligament, and the medullary bone.
Okay, so three sources. Sounds like a pretty good backup system.
You'd think so, right? But here's the catch again. The medullary bone supply is limited in the coronal aspect of the facial plate.
So it's like the facial bone is starting off at a disadvantage.
Exactly. And then when we extract a tooth, we disrupt the blood supply from the periosteum and periodontal ligament, making it even more vulnerable to resorption.
Wow, that makes a lot of sense. Which brings us to our main attraction today, physics forceps.
Mm-hmm.
They seem to be all the rage these days.
Yeah, for good reason, too. They're a game changer when it comes to atraumatic extractions.
So how do they actually work?
It's all about using the body's natural mechanisms to our advantage. Instead of brute force, we're using controlled tension and a little help from an enzyme called hyaluronidase.
Hyaluronidase. Remind me what that does again?
It basically breaks down the components of the periodontal ligament, gently releasing the tooth from its socket.
Ah, so we're letting biology do the heavy lifting.
Precisely. And it all starts with precise placement. The beak of the forceps goes subgingivally on the palatal or lingual surface, and the bumper, that little arm on the forceps, is positioned strategically to maximize the effect.
Okay, so we've got the beak and bumper in place. How do we actually engage the tooth?
This is where the magic happens. We apply gentle, continuous tension to the periodontal ligament by rotating our wrist, no squeezing involved, and this allows the hyaluronidase to do its thing, breaking down those attachment fibers.
It sounds almost effortless.
It really can be. And patients are consistently amazed by how easy and painless the extraction is.
That's what we like to hear. But what about those more challenging cases, like multi-rooted molars with stubborn roots? Can we still use physics forceps for those?
We can, but sometimes we need to bring in some reinforcements. Our deep dive highlighted the importance of sectioning teeth in these situations.
So we're basically dividing and conquering.
Exactly. We're turning one tricky tooth into multiple single-rooted teeth, making them much easier to extract atraumatically.
Smart. And of course, after we've extracted the tooth, we can't forget about socket preservation. Our research really emphasized how crucial this step is for maintaining bone volume.
Absolutely. Socket preservation is like setting the stage for successful healing and future implant placement.
And there's a whole world of grafting materials out there to choose from. How do we navigate that landscape?
You've got your allografts, xenografts, and alloplasts. Each one has its own pros and cons.
So it sounds like there's no magic bullet. It's about choosing the right material for the specific situation.
Exactly. And we need to have those open and honest conversations with our patients about the different options available.
Transparency is key. And let's not forget about membranes. They're like the unsung heroes of socket preservation.
They really are. Those little barriers protect the graft material and allow the bone to regenerate undisturbed.
And speaking of undisturbed, our research really stressed the importance of proper membrane placement. If that membrane doesn't stay put, the whole plan can go south.
It's all about those little details that make a big difference in the long run.
So we've covered atraumatic extraction techniques, the importance of socket preservation, and the different grafting materials available. What else should we keep in mind as we strive for atraumatic excellence?
Well, one thing that stood out in our research was the emphasis on thorough irrigation and rinsing of the socket before grafting.
So it's all about creating a clean and healthy environment for those bone-building cells to thrive.
Precisely. And another important point is to avoid using chlorhexidine in the socket.
Really? Why is that?
While it's a great antiseptic in other situations, research shows that it can actually hinder bone healing.
Huh. That's good to know.
Oh,
So saline or sterile water it is for that final rinse.
exactly. And finally, let's not forget about the human element of all this. Clear communication with the patient is absolutely paramount.
Absolutely. We need to make sure they understand the benefits, risks, and costs associated with grafting procedures.
Informed consent is key. We want our patients to feel empowered and involved in their treatment decisions.
Well said. We've covered a lot of ground already, but there's still so much more to explore.
Definitely. In the next part of our deep dive, we'll be delving into the long-term benefits of atraumatic exodontia, the nuances of managing patients who smoke, and how this atraumatic philosophy can extend beyond just extractions.
Sounds fascinating. Can't wait to continue this conversation. Stay tuned, everyone.
Welcome back, everyone.
It's amazing how much there is to consider when it comes to atraumatic exodontia. We've only just scratched the surface.
It's true, there's a lot more to it than just yanking out a tooth.
And in this part of our deep dive, we're going to explore the long-term benefits of this approach and how this atraumatic philosophy can really impact other areas of dentistry.
It's about thinking beyond the immediate procedure and considering the bigger picture.
Exactly. So let's talk implants. We touched on how socket preservation can set us up for success with implants, but I'm curious to hear more about that connection.
Well, it all boils down to creating the ideal environment for osseointegration, that magical process where the implant fuses with the bone.
Right, and we want that fusion to be as strong and stable as possible.
Exactly. And when we extract a tooth atraumatically, we're minimizing damage to the surrounding bone and soft tissues.
So it's like we're giving the implant a solid foundation to build upon.
Precisely. It's like building a house on solid ground instead of shifting sand.
I like that analogy. And it makes sense that a healthy foundation would lead to better long-term stability for the implant.
Absolutely. Atraumatic extractions can also increase the chances of achieving primary stability, which means the implant is nice and secure right from the start.
And that's especially important for those immediate implant cases, right?
You got it. But it's not just about the implant itself.
Right. It's about the health of the surrounding tissues, too.
Exactly. We want to preserve the bone and the soft tissue architecture so we can maintain those natural-looking contours.
It's like creating a harmonious balance between form and function.
I like that. Harmony is a good word to describe it.
Speaking of balance, I'd like to revisit the topic of smoking. We talked about that professor who wouldn't place implants in smokers, and it got me thinking, is smoking always a deal breaker?
It's a great question, and honestly, it's not always a black and white situation.
So it's more nuanced than that.
Definitely. While smoking does pose significant challenges, it doesn't automatically disqualify someone from getting implants.
So how do we approach these cases then?
It's all about careful assessment, risk management, and open communication with the patient.
So a case-by-case basis.
Exactly. We need to understand their smoking history, their willingness to quit, and any other health factors that might be relevant.
And then have an honest conversation with them about their options and what to realistically expect.
Exactly. We need to be upfront about the potential impact of smoking on their treatment outcomes, but also empower them with knowledge so they can make informed decisions.
And speaking of informed decisions, another thing that stood out in our research was the importance of cost transparency when it comes to grafting procedures.
Oh, absolutely. Grafting materials, especially those derived from human sources, can be a significant investment.
Right, and we need to be transparent with our patients about those costs.
It's about providing value and making sure they understand what they're paying for.
Transparency and trust are essential for any successful doctor-patient relationship.
Couldn't agree more. Now, shifting gears a bit, our research presented this really intriguing idea of atraumatic dentistry extending beyond just extractions.
That's right. It got me thinking about how we can apply this philosophy to other aspects of our practice.
It's a fascinating concept, right? It challenges us to think outside the box.
It's about shifting our mindset and approaching every procedure with the goal of minimizing trauma and maximizing patient comfort.
Exactly. And that can apply to everything from how we administer local anesthesia to how we handle tissues during a cleaning.
It's about creating a culture of gentleness and respect in our practice.
And when we do that, we create happy patients, happy dentists, and happy outcomes all around.
Love it. So we've gone from the specifics of atraumatic extractions to this broader vision of an atraumatic approach to dentistry. It's pretty inspiring.
It is. And there's still more to come. In the next part of our deep dive, we'll be sharing some bonus insights and practical tips that I think our listeners will really appreciate.
Oh, I can't wait. Stay tuned, everyone. We're back for the final part of our deep dive into atraumatic exodontia, and I'm still thinking about that question we left our listeners with.
You mean the one about how we can apply this atraumatic mindset to other areas of dentistry?
Exactly. There are just so many possibilities.
It really gets you thinking outside the box, doesn't it?
It does. For me, one area that immediately comes to mind is managing dental anxiety.
Oh, yeah, that's a huge one. For so many patients, fear and anxiety are the biggest obstacles to getting the care they need.
And if we can create a more calming and supportive environment, it can make a world of difference in their experience.
Absolutely. It's about those little things, like explaining procedures in a way that's easy to understand.
Right, using a gentle touch, taking the time to listen to their concerns.
And of course, making sure they're comfortable throughout the procedure.
Effective pain management is key. And there's so many techniques we can use to minimize discomfort during injections.
Oh, yeah, like using topical anesthetic beforehand.
Right, or warming up the anesthetic solution.
It's amazing how much those little details can impact the patient's overall perception.
And speaking of perception, something else I've been thinking about is how this atraumatic approach can even extend to the materials we use.
Oh, that's a great point. We have so many options now when it comes to dental materials.
And choosing materials that are biocompatible and promote faster healing can really enhance the patient experience.
It's about thinking holistically, considering not just the immediate procedure, but also the long-term health of the tissues.
Exactly. And it all comes back to that core philosophy of minimizing trauma and maximizing patient comfort.
It's about shifting our focus from simply fixing teeth to truly caring for people.
I love that. It's about building trust, creating positive experiences, and empowering our patients to take an active role in their oral health.
And ultimately, that's what leads to the best outcomes for everyone involved.
Well said. So as we wrap up this deep dive into atraumatic exodontia, we want to thank you all for joining us on this journey.
It's been a pleasure sharing these insights with you.
And we hope you've gained some valuable knowledge and maybe even a few aha moments along the way.
But the conversation doesn't end here. We'd love to hear from you, our listeners.
What are your thoughts on this atraumatic evolution in dentistry?
What techniques or approaches have you found to be particularly successful?
Share your experiences and insights with us on social media. Let's continue this conversation and learn from each other.
Because at the end of the day, it's all about raising the bar for patient care and creating a better future for dentistry.
We can't wait to hear from you. Until next time, keep those smiles shining bright